myself, okay, even Caucasian people, but certainly us that have some color in our skin, we are much, much higher risk of having problems. Lots of things that we get advantages on, but I got to tell you, heart disease is not one of them. We get heart problems from our genetics, from our mom and our dad and our grandma and our grandpa, right? So they gave us the gene that causes that heart disease. And it's important that we do everything we can. So get out there and check your blood pressure. Right? When you go to check it, here's a couple of rules. Number one, don't have a cigarette, coffee, or caffeine within 30 minutes of checking that number. That is going to give you a false number. Okay. Number two, sit down for about 30 seconds before you hit the button. Too many times you do that machine, you sit down, you hit the button, your arms sit on there, you haven't had a chance to rest, and that will give you a false number. And those are a couple of hints. You can also keep both feet on the ground, don't cross your legs. That will cause your blood pressure to climb. All right? The second thing that can affect us is diabetes, especially Hispanic men like myself. Right? But black men and white men are also affected. Asians, not as much, but we can all get diabetes. And the number one risk factor for getting diabetes is, again, your mom and dad. But the number two risk factor is right here. Things that we eat to put weight around the middle. If you look down and you have a hard time seeing your toes, right, you're at risk for having diabetes. If you can reach down there with your hands and grab a little extra around the middle, you're at risk for having diabetes. But diabetes is a problem where your body cannot digest sugar. And unfortunately, sugar is the most important part of energy source that our body needs. So we're constantly fighting this battle of trying to eat sugar and then process it. The problem is most of us eat too much sugar. We don't need but about 15 to 30 grams of sugar per day, and we tend to see most people eat about 150 to 200 grams per day. So if you look at it on the side of your Coke can there, it probably has roughly 60 grams of sugar. So that's about a week's worth of sugar in there. And that's how we get into trouble, because all these little things are around us and we don't know it. There's 12 grams of sugar in a cup of milk. All right, there's usually 8 to 10 grams in a slice of bread. All right, we eat tortillas, we eat chips, we eat all these things that they tend to cause that sugar to climb. So most of the time we can handle it. But if you're one of those people like myself and have a family history of diabetes, then we may not do as good of a job as other people. It's possible to get in trouble. Right? And number third cause of problem in America is cholesterol. Now here's the thing. We all hear that word cholesterol, and most of us don't know what it means. It's not very expensive to check. In my office, it costs around $15 to check a cholesterol level. And I'll tell you, there's lots of times where you can go to a free clinic and you can get it checked for free. You can go to a health fair and they can check it for free. Right? So anytime you can check your cholesterol, that's going to be very important to know. If you know your blood pressure, you know your sugar numbers, and you know your cholesterol numbers, then you're doing something right, because those are the number 3 things that will cause you to have heart problems and section before it's your time. The last thing that I always talk about is prostate. Because as men, women, we don't have prostate, only men. Okay, men, we have a prostate, and it's very important when we're trying to have babies. And as we get a little bit older, and we're over 40 years old, over 50 years old, that's when we start to have problems with our prostate. That little bump that we get in there sometimes is very, very difficult to feel. Right? It's difficult for doctors to feel it, and so the best way to check it is if you're having any problems peeing. So if you have to stand at the toilet for a little while before you start to pee, right? If you ever notice blood when you go pee, right? If you ever notice blood after you ejaculate, right? If you ever have pain in that process, then you should talk to somebody about your prostate. Because prostate cancer is the number 1 type of cancer that men get. Now, it's not the number 1 reason that men die from cancer. That's from smoking, right? And that causes lung cancer. But the number 1 cancer that men are going to get over a lifetime is going to be prostate cancer. And the nice thing is, if we catch it early, if I catch your prostate cancer in the early stages, the odds of you dying are almost 0. Okay? In the year 2013, we can catch all those things now. Right? So let's review. Number 1, blood pressure. That one's free, easy to check. Number 2, diabetes. That one's virtually free. It costs about $5 to know what that one costs. And to know what your level is. Okay. Number 3, cholesterol. That costs about $15 to know. And then last is the prostate. If you're having any symptoms, then it's worthwhile to talk to somebody if you should get this checked. Okay, so I'm going to hang around here. I'll be walking around. If you have specific questions, grab me. If it's not about these 4 topics or about heart disease or something else, I'll be happy to hang around and answer questions. It's sometimes hard to get in front of the doctor, I know that. And I'm available today if you guys have some questions. Free consults right here. All right, guys? Everybody have a good day. Let me know if you have any other questions.